What's your address? It's automatically disabled.
I was like, this is a mess. It's time for me to hang it up.
So Randy, then you can cross.
You got a card too? Alright. I think I was getting arrested.
Should we go find the code and do a burn house road? I'll do it legal. And it's both legal and recess. What are they gonna do? Bring us down or throw us in school? I'd like to go down there.
I'll say you got more people. Say trick or treat.
No, we're good. No, don't talk.
Okay.
Reminds me of like that's old. You burn your house down. We have a domestic. Go, man. You're like, oh my God, with a speeding ticket? Somebody like stole it. What did he steal, like a dozer or something? Oh yeah, he stole it.
It's appropriate.
I don't think so. 7:30. There's a lot of stuff on here. When I read this, I'm gonna talk about it's every Saturday or every other first Tuesday of every other week.
Guys, if you want to sign in, there's a sign-in sheet right there, and there are a copy of them.
This was happening. Yes, they would. I would have came. You go along. Yes. Greg told me he was coming. Even if I didn't have good citizen. Dude, I really want to transport the car.
Let's call meeting to order. Billy, you want to lead us in the pledge of allegiance?
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Yeah, I'd like to ask for a moment of silence in remembrance of 9/11.
Thank you, everyone. First up, privilege of the floor. Anybody would like to address? How did I know that?
Hi, good evening. My name is Carol Morrissey. I'm president of Tanglewood Lake Homeowners Association. And I just wanted to see if we had any follow-up on the flood mitigation review status and what comes
Still waiting to
next.
see their final draft. They're
Okay.
still,
Is there a date for the final draft, do you know, that they
I
need to
thought it
be
was gonna
done?
be out a month ago, so obviously I don't know anything about their schedule, but
Okay,
it's gotta be done before the end of the year, is my understanding. And they wanted to have it done well before that, so I'm anticipating within the next few weeks.
okay, and once it's done, is that public record? Can I get a
Yeah.
copy of it or be notified?
I don't know, if it'll be a big one, you may not want the whole record, but you can, I think we can at least get you a webpage to access it.
Okay, great, thank you very much.
Okay. Yes.
Hi, Dan Ayers, I live in Village Delhi. I'm here to inform the town of work that I'm involved with the Delhi EMS squad. A number of months ago, I was asked to engage with them as they are considering converting to a paid squad from a volunteer squad. We've had a number of meetings. Right now, we're having exploratory discussions with the town of Sydney, where they also made that transition. I think you're probably aware of the challenges to the EMS squad being volunteers, the number of hours required for training and education, the fact that there just aren't enough volunteers. The volunteers have expressed that they are feeling burnt out and just cannot continue, and so they feel like the change needs to occur. We looked at a couple of different options. One option, obviously, is contracting with an existing service. I think the price of that would probably be prohibitive. Secondly, transitioning this squad to a paid squad would take about a couple of years in order to accomplish. They would need assigned administrative support, which I don't think any of the municipalities could really afford to provide. And it would require starting capital also, which would, in that case, be taxpayer money. So we were investigating working with Sydney, which has made that transition rather successfully. It could be rather quick, and it would maintain local EMS coverage. It would, obviously, the improvement would be in the response time. It would be an improvement to the tax burden, as in they would be paid and be paid by billing for their services. One of the primary issues is they could get transfer agreements with 3 major entities within our community, which is the hospital, the nursing home, and the college. All 2 of which I've already had discussions with, and they're interested very much in that agreement because their current service, they feel as though they are underserved. So there are a number of issues. You have my report in front of you that still need to be addressed. I won't go through them in detail, only that these are the issues that will need to be addressed as we go through developing a pro forma. That work is undergoing now. I've been asked by the Fire Commission if we'd be able to deliver on this by the first of the year. That's an aggressive timeline, but one which we are seriously investigating. The major issues are going to be the transfer of the certificate of need, how the assets will be leased to the new entity, naming and a number of other details. Lawyers are currently involved to assist with many of those details. So no definitive decision at this point, but a lot of work is going forward, and want to be sure that this municipality was aware of the work that's going forward.
Thanks, Dan.
Any questions?
Sydney is interested.
Absolutely. What happens is, if you look at it as a business model, it is, you have an existing infrastructure with now additional volume. So that, you wouldn't have to replicate things like billing service, payroll, policies and procedures. All of those things can be easily replicated, so you're not reinventing the wheel. And so you would have more revenue coming in to offset that overhead.
Scott, I have a question you might be better able to answer. Obviously, this is something that I've looked at with you in the past, and a couple of years ago when we were kicking it around, we were finding that on average between 30 and 40% of our EMS responses were not in our tax district. Is that still holding true?
That's relatively true. I mean, we get called for mutual aid in a lot of areas. That's part of the concern that's behind this, is that we feel obligated that there's a community, community sense of service, that the department wants to serve the community, and that we have that level of need, and we don't want to let the community down. New York State says this is a non-essential service. I don't know why, but that's their ruling. Fire is required, EMS is not. So as people, get less release time from work, and it becomes difficult to meet the training requirements on a volunteer basis, they see the service declining and they say, hey, this is not how we want to treat our community. What we've seen, we do calls usually on like Saturday, we're get 2 or 3 calls out of Walton because Walton can't crew. We see Stanford, who dissolved their EMS and they have a first responder service, that's it. So we don't want to see that happen to Delhi. Sydney was very aggressive and formed, I think the thing I should talk about is that it is a nonprofit corporation. So the nonprofit service is a bit different than a for-profit model. So they will accept insurance payment. They also have the ability as a nonprofit in their mission to forgive
Provide charity
non-payers, charity payments for if someone could not provide. That's something different. Normally in the commercial model, you get turned over to a collection agency. So we feel it's a more fitting, compassionate service to what we have provided in the past, but that we don't have the paramedics to cover the same amount of hours. This is a way to help do that. Delhi EMS would still exist in some form, but probably more like a first responder service to assist both the firefighters and this service, but that you would have full-time paid crews that would be available to serve the community. That kind of answer.
Yeah,
I actually think what will happen is when Delhi makes the transition, you'll see many of the other local communities also make the transition because everyone else is having the same struggle.
well, and you make an interesting point there, and I have to wonder, every town is having that struggle currently. So Delhi transitions and then say Walton transitions. Where are the paramedics and EMTs going to come from that are?
That becomes a new business. That actually becomes a new business where they're going to have to hire these people, and these people will come to our community. Most likely live in our community.
We hope.
Well, they're, I don't know how far they're willing to commute in order to be a paramedic, but there are many, I think many of your volunteers would like to transition to a paid status.
Well, I would agree with that statement.
And I think that actually, the opportunity exists that many paramedics will leave the other places where they may be employed and come to a more community-based. That's been the experience that Sydney had, that they, because of the nonprofit status in the community, and kind of the being so closely involved with the community, that many of the paramedics came to them. They actually have not, surprisingly, did not have a lot of problems with recruitment.
Well, that's good to hear. It is not easy to recruit volunteers, that's for certain.
And, if you think of it as, if our volunteers become employed, then that opens up other vacancies in other businesses, again, to help draw people to our community. So really, you're talking about a new business kind of starting here. And I will tell you, one of the advantages that Delhi has is because of the primarily the 2 healthcare institutions plus the college provides enough volume to make it financially viable.
Even without doing transports.
You need to do transports.
I was gonna say,
You have to do
understanding
transports.
was that
I will tell you this, I've been in rural healthcare 30 years. This is the 3rd time I've been involved with a nonprofit becoming a private squad. And every time they have actually succeeded and done well.
So the main difference between what we're seeing, the other ambulance service in the area and this is they're for profit and this is nonprofit.
Nonprofit.
And it basically would be in conjunction with, I mean, it would all be, Sydney, Delhi, it would all become the same thing, or would we be a separate entity operating similar to what Sydney?
You know, it's probably gonna end up being doing business as.
Uh-huh.
I mean, there's definitely, I mean, I heard someone say, why don't you call it Delaware County EMS? You know, I think there's some thought to that. But it will be, at least the initial discussions is, it'll be identified as Delhi EMS, and that there will be representation from Delhi on the board. That's one of the ways that you ensure that it has a community connection. And Sydney actually, they recommended that.
I think one of the big changes is to provide the community coverage, you have to go to paid so that we have reliable service to the community. So you've got to pay staff, and there's only a couple ways to do that. Fire districts, specifically in the state of New York, are prohibited from charging. Now, a village is not, a town is not, but our hands are tied if we are not allowed to even just rebill and just take, say, insurance money to help offset some of the expenses so that we can pay staff. So that's why we've had to look at the other channels for how can we make this transition without just flat out, signing a big contract with a commercial provider and passing that fee on. Are there other models that are more friendly to the taxpayer? And this one seems to have worked quite well in Sydney. As Dan indicated, they've been up and running, what, 3 years now? Maybe a little longer?
Longer than that, I think
Yeah.
4 or 5 years.
4 or 5, so, they have the experience, and then there's startup capital. That
And
can
actually-
become a challenge that we have to look at.
And actually, I'm the representative for the DISRIP, Delivery System Reform Incentive Payment Group, Leatherstocking Healthcare Partners LLC. And so I have the ability to help access additional funds through this DISRIP funding in order to help make this transition. And I've already floated that, and there is an interest in that. Of course, there are other grant opportunities that are available. There's just a lot of ways that we can make this happen.
And so Sydney offers a lot of that because they've done the startup, they're past that. Not to get into too much detail, but places like Medicare, you're talking 6-12 months before you receive your first payment. Sydney already has an established billing code. They can bill immediately, they can receive payment next month. So there's part of the advantages of doing this is it's an operational model that doesn't need a big capital outlay to get off the ground. And I think over time, like if we're successful, this seems to make sense. You're probably going to see a bridge built. I know there are communities between here and Sydney, at least 2 of them having conversations with Sydney besides ourselves. That only leaves one that's not. So, we've talked about the advantages of that. There's advantages to the community as well. As if, right now we have an ambulance breakdown, we have an ambulance down, where, you may have more staff if somebody calls in sick, more. So, we think it's advantageous, but we continue to explore, and we just wanted to share with the community and make sure it kind of words out there. So if people have questions, they can approach us. The fire district itself meets the first Thursday of the month at 8 p.m. at the fire hall. It's an open public meeting just like this, so welcome to come.
You both did an excellent job explaining how the kind of meetings. I just wanted to say a couple things that resonated with me as a town representative at the meetings. Bill touched on it. According to the statistics we saw at our last meeting, in the past 2 years, 1 in 4 calls goes outside of the district, outside of our fire district. That was just the past 2 years. So that means that taxpayers are paying, 1 out of every $4 is paying for Walton, for example. So as a municipal representative, that's something I think we have to pay attention to. And furthermore, people expect this service, whether or not it's essential. They do expect it, or the people who vote for us. And after sitting in the meeting, I confess I was totally naive about how it operates. It's volunteers, and these people are definitely burned out. I mean, they're still going every time, but if they didn't want to, they don't have to, and that's a life or death situation. So I felt like it's a really critical, we're at a critical point, and the fact they've given me Dan this end of the year aggressive timeline, I understand why. So from what I know, it seems like something that we should consider very seriously.
Yeah, I think it's been kicked around for years and years, and it just has never taken the next step. So I'm glad to see that they're finally pushing forward to get a real plan together.
Yeah.
So,
The job creation is a big thing too. I mean, there's several jobs involved too, which is hard to come by here.
Yeah, I think it's great. I'm glad you guys are working on it. It's definitely something that's needed. I'm an old EMT from a long time ago, and I know the training you have to go through now, there's just no way. I understand why people just don't wanna do it anymore. A lot of people wanna do it, but they just don't have time. You know, the time you have to put in your own, and
it's tougher on
it's a big
employers.
commitment.
Employers have a hard time letting these people
Absolutely,
run off the job,
yeah.
and if you have to do a transport, then you're gone for half a day or more. So it's, you know, if we want to provide first-class health care for our community, we need to have a rapid response EMT program.
Yeah.
As a healthcare professional, you said it exactly right. If we want to provide good healthcare, it starts with the emergency and continues on through that.
You know, I can tell you, we're also working, I just this morning had a meeting where we are looking at doing what's called physician-directed home care, which is basically paramedicine in the home. And we're getting that project ready to up and run in Sydney in very short order, in which case, if this transition occurs, we can then bring that program here very rapidly. So really some aggressive things starting to happen, and really would make a huge difference to our community.
Great.
If I can put on another hat for just a minute, I won't take nearly as long. I'm also the chair of the Delhi Beautification Committee, and I'd like to respectfully request that you consider an increase to our budget this year from 1,000 to 1,500. Plants are more expensive. We have to do phase replacement of our barrels, and actually, while we do not have a lack of willing hands, it takes plants for those willing hands to do good in our community. So if you would, I'd like to respectfully request you increase our budget to $1,500. Thank you.
Thank you.
I'd like to thank you for all that the beautification committee does in the village. I mean, I go to a lot of different places, and people that have been through Delhi always comment on how nice it looks, and there's a lot of work going on, you know, so appreciate that very much.
We thank Janet too.
Yes.
She's one of our executive board members.
Yes,
You have it on that.
Anybody else want privilege of the floor?
One more time.
Are you Richard or the judge?
Hey, it's Richard. Well, no, it's the judge actually on this one. I'm gonna seize the moment. As you can see, we have a pretty packed courtroom tonight. And I can tell you on our first and third Tuesdays, when we have the prosecutors here, we have standing room only, we have people waiting outside to get in here.
I hope you don't recognize any of them.
I'm not looking. Not even to check the sign-in list. My suggestion is this, and I've been flirting with this idea, that I'd like the board, not tonight, but to consider reconfiguring the room. And I don't know why we didn't think of this originally when we did this particular construction. But I'd like the board to consider changing the dais so that the dais would face this way and the seating would be in that direction. And I think you pick up about 20 or 25 feet of additional space for people to sit as far as that all is concerned. I don't think it's gonna take a lot of money. Obviously, it's labor and materials. The materials are here at this point. It's just basically turning the platform to face in that direction as opposed to the direction it's currently fitting, because we just don't have the seats. I mean, it's embarrassing, especially when you have the rainstorms that we have, or we know what the cold is like, and the people are out there in below freezing temperatures, and there's no seats in the courtroom, and it's standing room only. So I'd ask the board to consider possibly reconfiguring the courtroom, and I'm gonna take some steps to give you
Is
some
that gonna be
proposals.
part of resolution number 9 of 2018?
Yes, I would like to do that. The only thing I understand is that we'd really have to get some drawings together to incorporate that into the application for the JCAP money. That helped us the last time, so it's not that it's impossible, and I don't think it's gonna be that great a cost to just reconfigure with most of the materials being here. It's mainly what the labor is gonna be, if the board agrees that it might be the better way to have the room configured so that we can get more people in to the courtroom when we have those days. And like I say, it happens more regularly than not. Don't know how that speaks to what's happening out here on the street. I just know that the number of people coming in here on the first and third Tuesdays, it's just standing room only.
Sounds like you need more hours in court.
Thank you very much. Thank you. Talk to the DA. You have to have a DA here. That's the only problem with that. I joined that application, I'll tell you that.
I see we've got a bunch of students here, I assume from SUNY Delhi. You representing one class in particular, or
Yeah, American government.
American government? Do you get extra credit for being here?
No.
No,
I don't either.
homework.
Alright. They don't pay me any more to be here either, so. Welcome, glad to see you here, and welcome to Delhi.
Thank you.
And hopefully you won't see the judge again.
I don't take that personally.
He's really a nice guy, unless he has the black robe on.
But as you heard, he doesn't have room for you any other time.
He might make you wait out in the cold this winter, so. Anybody else, privilege of the floor? All right, moving on. Approval of the minutes from August 14th meeting.
Make a motion to approve.
I had one addition. Or, I think I said it last time, but it was just that, the rationale for not going with the voicemail was not only just the cost, but also because of the needs of having to come into the office to check those voicemails because of the current phone system that we have. So if that could just be added, that it was also,
Can we just put it won't work?
it's not just the cost, it's also just the manpower or the inconvenience to us council members to have to come in to check the voicemails because of the current system that we have. That makes it also unreasonable to go.
Do you want to amend your motion?
Make a motion to accept the minutes with the addition that Jim just said.
No second it?
All in favor? Aye. Carried. Okay. Old business, the annexation, the village has filed the local law, so we should be done with that, so. The motel and the houses are eligible to get hooked up to water and sewer, so hopefully everybody's happy. Ramley Mountain Fire Tower.
I gave you all a copy of a draft MOU that we are, this is for discussion purposes only, it hasn't been shared outside of this room. So we agreed last time that we should lay out we're talking about, for anybody who's listening out there, Ramley Mountain is a mountain outside of town, there's a hiking trail that goes to the top, it's 2 miles long, you get to the top, it's beautiful. There used to be a fire tower there, that's where rangers used to stand and look for fires. This used to be a job. The fire tower's been relocated, I mean, it was taken down a long time ago, and a group wants to put it up, the Catskill Mountain Club. They asked us to work with them on that. So the duties, the responsibilities that I think are laid out on this piece of paper. They have a lot of responsibilities and we have two. Our responsibilities would be to either lease or accept the fire tower as a donation from the owner in order to be able to include it in our insurance policy. So we discussed it at length the last time, and we, as I recall, we all thought it was not cost prohibitive, but we wanted to make sure that we knew what our duties were. So this is here for you all to review, and if we decide that we like what's on this piece of paper, then it will be signed by the town and the Catskill Mountain Club, and then they will proceed to work with the DEP to try to get the permanent easement so that it can be used by the public. And I'm in favor of this thing. So,
Okay, I'd like to hear a little bit more about the word lease.
yeah, well, that's probably